hemostasis, thrombosis, and embolism. First, hemostasis. So, what is hemostasis? Hemostasis can be defined simply as the process by which blood clot form at site of vascular injury. যেখানে ভাস্কুলার ইনজুরি হচ্ছে সেখানে stoppage of bleeding is called hemostasis. Hemostasis is essential for life and is given to varying degree in a broad range of disorder. In hemorrhagic disorder characterized by excessive bleeding, hemostatic mechanisms are either blunted or insufficient to prevent blood loss. By contrast, in thrombotic disorder, blood clot, often referred to as thrombi or thrombus, form within intact blood vessel or within the chamber of heart. So, when stoppage of blood occurs in an injured tissue, it is called hemostasis. So first, normal hemostasis. Hemostasis is a precisely orchestrated process involving platelet, clotting factor, and endothelial that occur at the site of vascular injury and culminate in the formation of a blood clot, which serve to prevent or limit the escape of bleeding. So first is arteriolar vasoconstriction. Arterial vasoconstriction is the first process. It occurs immediately and markedly reduces blood flow to the injured area. It is mediated by reflex neurogenic mechanism and may be augmented by the local secretion such as endothelial. Then, primary hemostasis. Primary hemostasis is the formation of platelet plaque. Primary hemostasis occurs by platelet only, nothing but the platelet. With the help of Willebrand factor. Secondary hemostasis occurred by deposition of fibrin. Vascular injury exposes tissue factor at the site of injury. Tissue factor is normally expressed by sub-endothelial cell in the vessel wall. Tissue factor bind and activate factor 7 that culminate thrombin generation. Thrombin কি করে? What is the function of thrombin? Fibrinogen to fibrin. After fibrin formation, fibrin meshwork formation হয়. So primary hemostasis by platelet, secondary hemostasis by deposition of fibrin. Thrombin flips circulating fibrinogen into insoluble fibrin, creating a fibrin or fibrin meshwork, and also is a potent activator of platelet, leading to an additional platelet aggregation at the site of injury. Now, the last step is clot stabilization and resorption. Polymerized fibrin and platelet aggregate undergo compression to form a solid permanent plug that prevent further hemorrhage. At this stage, counter-regulatory mechanism like tissue plasminogen activator made from endothelial cell set into motion that limit clotting to the site of injury, eventually lead to clot resorption and tissue repair. শুধু clot formation হয়ে গেল, কিন্তু ওটা রিজর্ভ হতে হবে, reabsorption হতে হবে। It should be emphasized that endothelial cells are central regulator of hemostasis. The balance between the antithrombic and prothrombotic activities of endothelial determine whether thrombus formation, propagation, or dissolution occur. It is the fate of thrombus. We will read it in later. The first is vasoconstriction. After that, it is the point of tissue injury. So what happens after tissue injury? Few platelet will come and it will adhere to the endothelial layer, basement membrane, with the help of von Willebrand factor. Endothelial layer, with the help of von Willebrand factor, the first layer of platelet will adhere. It is called this primary hemostasis. After that another few platelet will come. Not few, many platelet will come to that first layer of platelet. It is called platelet aggregation. First was platelet adhesion, then platelet activation. Activation means formation of, not formation, secretion few granules like ATP, thrombus A2. So platelet adhesion, then platelet activation, then platelet aggregation. Platelet aggregation means attachment of one platelet with another platelet. So পুরোটা হচ্ছে primary hemostasis. Then secondary hemostasis. Secondary hemostasis means fibrin. Fibrin polymer will occur. পুরোটাকে fibrin দিয়ে just knot, tie a knot with fibrin. Then thrombus and antithrombotic events. কারণ clot formation হলো, কিন্তু শুধু clot formation হলেই হবে না, কারণ তো clot ওখানে রয়ে যাবে। ওটা ultimately with the time resorption করতে হবে। সেই resorptionটা হবে with the help of tissue plasminogen activator. That means fibrinolytic pathway. With the help of fibrinolytic pathway, clot will resolve. Now thrombosis. So what is the basic difference between hemostasis and thrombosis? Hemostasis occurs in an injured blood vessel, but thrombosis occurs in a normal blood vessel. It is dangerous. It is dangerous because it occurs in a normal blood vessel. যেখানে থ্রোম্বাস ফর্ম করার কোনো দরকার নেই, কিন্তু সেখানে থ্রোম্বাস ফর্ম করে যাচ্ছে। So it is dangerous. How it happens? By Virchow triad, endothelial injury, scasis or turbulent blood flow, hypercoagulability of the blood. Thrombosis is one of the scourges of modern man because it underlies the most serious and common form of cardiovascular disease. Most of the cardiovascular disease occur due to this thrombus formation. Endothelial injury, hypercoagulability, and abnormal blood flow. Endothelial integrity is the most important factor. এখানেও thrombus form করছে, তো how the thrombus is forming here? Same, যেভাবে hemostasis হচ্ছিল, যেভাবে clot হচ্ছিল, এখানেও ওরকমভাবেই হবে। এখানেও clot formation ওরকমভাবেই হবে। এই thrombus formation ওরকমভাবেই হবে। Injury to endothelial cell can alter local blood flow and affect coagulability. Abnormal blood flow, scasis or turbulence, in turn can cause endothelial injury. This factor may promote thrombosis. Clinical features: thrombi come to clinical attention when they obstruct arteries or veins or emboli formation. What is emboli formation? What is embolus? What is embolus? Dislodged thrombus. যখন থ্রোম্বাসটা ডিসলজ হচ্ছে from that site, তখন সেটাকে বলা হচ্ছে এম্বোলাই। The clinical presentation depends on the involved site. Venous thrombi can cause painful congestion and edema, discomfort and obstruction, but are mainly of concern due to their tendency to embolize to the lungs. এই embolize lungs চলে যায়। Venous thrombosis or phlebothrombosis. Most venous thrombi occur in the superficial or deep vein of the leg. Such thrombi can cause local congestion, swelling, pain, and tenderness, but rarely embolize. যতক্ষণ না embolize form না হচ্ছে ততক্ষণ অবধি কিন্তু ও মুভমেন্ট থাকবে না, ও ওই জায়গায় ফর্ম করে থাকবে। থ্রম্বাস ক্যানট মুভ, থ্রম্বাস মুভ করতে পারে না, মুভ করলে সেটা থ্রম্বাস হয়, তখন এম্বোলাস ফর্মেশন। Edema and impaired venous drainage predispose the overlying skin to the development of infection, varicose ulcer বলে এটা। Deep vein thrombosis or DVT, involving one of the large leg veins at or above the knee, like popliteal, femoral, or iliac veins, is considered serious because such thrombi more often embolize to the lungs and give rise to pulmonary infarction. যেরকম বললাম, যখনই মুভমেন্ট করবে তখন এম্বোলাস, এক জায়গায় থাকলে সেটা থ্রম্বাস। Arterial and cardiac thrombosis. Atherosclerosis is a major cause of arterial thrombosis because it is associated with loss of endothelial integrity and with abnormal blood flow. Atherosclerosis. Both cardiac and aortic neural thrombi are prone to embolization. Although any tissue can be affected, but important is brain, kidney, spleen. These are important because reach of blood supply. Now the first step is endothelial injury. Endothelial injury leading to platelet activation and it will cause thrombus formation. যেরকম বললাম hemostasis, যেরকম বললাম এই সেম প্রসেসিং হবে। Cardiac and arterial clot are typically rich in platelet, and it is believed that platelet adherence and activation is a necessary prerequisite for thrombus formation under high shear stress such exists in arteries. Obviously, severe endothelial injury may trigger thrombosis by exposing Willebrand factor and tissue factor. এইগুলো লাগবেই, Willebrand factor and tissue factor. Endothelial activation or dysfunction কি করে হয়? By physical injury, infectious agent, abnormal blood flow, inflammatory mediators, hypercholesterolemia, homocystinemia, and cigarette smoking, toxin from cigarette smoking. This is the endothelial, subendothelial collagen, RBC. এখানে ইনজুরি হলো, এখানে ফাইব্রিন স্ট্র্যান্ড ফর্মেশন হলো, লিউকোসাইট হলো, এখানে ক্লট ফর্মেশন হয়ে গেল। The role of endothelial cell activation and dysfunction in arterial thrombosis. Procoagulant changes. First is procoagulant changes. Endothelial cell activated by inflammatory cytokines downregulate the expression of thrombomodulin. Thrombomodulin is anticoagulant. Thrombomodulin is anticoagulant. Key modulator of thrombin, but thrombin causes coagulation, and thrombomodulin is anticoagulant. It controls the action of thrombin, enhancing procoagulant and pro-inflammatory action of thrombin. Inflamed endothelium also downregulate the expression of other anticoagulants such as protein C and tissue factor protein inhibitor. Protein C also anticoagulant. তো যদি এগুলো কমে যায় তাহলে coagulation হবে, clot formation হবে। Now, antifibrinolytic effect. Activated endothelial cell secrete plasminogen activator inhibitor, which limit the fibrinolysis and downregulate the expression of TPA, tissue plasminogen activator. Alterations that also favor the development of thrombi. You all know, I think. সবাই জানো তো intrinsic pathway, extrinsic pathway. Intrinsic pathway starts from factor 12 and extrinsic pathway starts from factor 7. And common pathway. Ultimately, what happens? The fibrin monomer, fibrin meshwork happens. But there are another pathway, it is called fibrinolytic pathway, which is from plasminogen to plasmin, then fibrinolysis occurs. So if this pathway active, যদি এই পাথওয়েটা অ্যাক্টিভ হয়ে যায় fibrinolytic pathway, তাহলে ওই যে ক্লটটাকে ও লাইসিস করে দেবে, যে ক্লটটা ফর্ম হয়েছিল সেই ক্লটটাকে ও লাইসিস করবে উইথ দ্য হেল্প অফ fibrinolytic সিস্টেম। Now, alterations is in normal blood flow. Turbulence contributes to arterial and cardiac thrombosis by causing endothelial injury and dysfunction, as well as by forming countercurrent that contribute to local pocket or scasis. Whereas scasis is a major contributor to development of venous thrombi. So scasis is the main contributor of venous thrombi formation. Normal blood flow is laminar. যতক্ষণ অব্দি ব্লাডটা নর্মালি ফ্লো করবে, ল্যামিনার ফ্লোয়ে থাকবে, ততক্ষণ কোনো ক্লট ফর্মেশন হবে না। Turbulence and scasis therefore promote endothelial activation and disrupt laminar flow. যখনই disruption of laminar flow হবে, তখনই ক্লট ফর্মেশন হবে। যখন নর্মাল অ্যাক্সিয়াল ফ্লোয়ে যাচ্ছে তখন কোনো ব্লাড ফর্মেশন নেই, নর্মালি যাচ্ছে, একটা ব্লাড ভেসেলের মধ্যে দিয়ে নর্মালি যাচ্ছে ব্লাড। কিন্তু এবারে টার্বুলেন্স হলো, তখন এটাকে বলা হয় মার্জিনেশন অ্যান্ড পেগমেন্টিং, মিনস প্লেটলেট, নিউট্রোফিল, আরবিসি all will go towards the endothelial cell layer. Normally endothelial cell layer সামনে থাকবে না, এখানে কি থাকবে? প্লাজমা, নর্মালি প্লাজমা থাকবে, আর মিডল পোর্শন দিয়ে যাবে প্লেটলেট, আরবিসি, নিউট্রোফিল, ডাব্লিউবিসি সবই চলে যাবে, কোনো ব্লাড ফর্মেশন হবে না, কারণ এন্ডোথেলিয়াল ইনজুরিটা নেই, নর্মালি কোনো এন্ডোথেলিয়াল ইনজুরি নেই। যখনই এন্ডোথেলিয়াল সেল ইনজুরি হলো তখনই শুরু হয়ে গেল পেগমেন্টিং, মার্জিনেশন অ্যান্ড পেগমেন্টিং, মানে এবারও ব্লাড ফর্মেশন শুরু করবে, তখনই ওখানে আর প্লাজমা থাকবে না, প্লেটলেটগুলো সব এন্ডোথেলিয়াল সেল লেয়ারের সামনে চলে আসবে। নাও hypercoagulability. Hypercoagulability refers to an abnormally high tendency of blood to coagulate or clot, and typically caused by alterations in coagulation factor. কখন হয় hypercoagulability? Primary factor 5 mutation, prothrombin mutation, increased level of factor 8, 9, 11 aggregation, মানে clotting factorগুলো বেড়ে গেলেই hypercoagulability স্টেট হবে। এছাড়াও অ্যান্টিথ্রম্বিন সি ডেফিসিয়েন্সি, প্রোটিন সি ডেফিসিয়েন্সি, প্রোটিন এস ডেফিসিয়েন্সি। Now secondary, strong risk factor for thrombosis, prolonged bed rest or immobilization, myocardial infarction, atrial fibrillation, tissue injury like surgery, fracture, burn, cancer, prosthetic cardiac valve, disseminated intravascular coagulation, heparin-induced thrombocytopenia, antiphospholipid antibody syndrome. Now morphology. Thrombi can develop anywhere in the cardiovascular system and vary in size and shape depending on the involved site and underlying cause. Arterial or cardiac thrombi usually begin at the site of turbulence or endothelial injury. Venous thrombi characteristically occur at the site of stasis. Thrombi are focally attached to the underlying vascular surface, particularly at the point of initiation. From here, arterial thrombi tend to grow retrograde, and venous thrombi extend to direction of the blood flow. কারণ একটা অর্গান থেকে ভেনাস ফ্লো যখন যাচ্ছে, ভেনাস ফ্লো টুয়ার্ডস হার্ট, আর আর্টেরিয়াল ফ্লো অ্যাওয়ে ফ্রম দ্য হার্ট টুয়ার্ডস অর্গান, সেই জন্য thus both propagate towards the heart. Thrombi often have grossly and microscopically apparent laminations called lines of Jahan, which are pale platelet and fibrin deposit, alternating with darker red cell layers. Means RBC layer, one layer is formed by RBC, red cell layer, another layer formed by platelet and fibrin deposit. Alternate dark and light. Thrombi occurring in heart chamber or in the aortic lumen are designated as mural thrombi. Abnormal myocardial contraction, arrhythmia, dilated cardiomyopathy or myocardial infarction, or endomyocardial injury promote cardiac mural thrombi. This is a mural thrombi. This is a mural thrombi. This is the line of Jahan. One layer formed by red cell layer, another layer formed by platelet and fibrin, alternate dark and pale. Now the fate of thrombus. Fate of thrombus, first is propagation. Second is embolization. Third is dissolution. Means clot যেটা তৈরি হয়েছিল ডিসলুট করে গেল বা রেজলিউট করে গেল। Then organization and reorganization. Means ওটা পার্টস করবে, মেবি ক্যালসিফাইড হতে পারে। First is resolution. Means resolute করে গেল, plotটা disappear করে গেল। Then organization. Here plot persists. Plot is fixed there, that site. Next is propagation. Plot increase করলো, যে প্লটটা ফর্ম হয়েছিল সেটা আরো ইনক্রিজ করলো, বড় হতে থাকলো। It will look bigger, much bigger. Last is thromboembolism. Like means ওটা থ্রম্বাসটা এম্বোলাইজ করে গেল, মানে মুভমেন্ট করা শুরু করে গেল, ওটাকে বলে thromboembolism. ছিল থ্রম্বাস, হয়ে গেল এম্বোলাস। Now embolism. Embolus is a solid, liquid or gaseous mass that is carried by the blood from its point of origin to a distant site. যেটা আমি বলছিলাম, যখন মুভমেন্ট করলো তখন আর থ্রম্বাস বলবো না আমি, তখন বলবো এম্বোলাস। যতক্ষণ এক জায়গায় আছে ততক্ষণ হবে থ্রম্বাস, যেই মুভমেন্ট করা শুরু করে গেলে এম্বোলাস। থ্রম্বাস মুভ করতে পারে না। The vast majority of emboli are dislodged thrombi. Hence the term thromboembolism. Other rare emboli, fat droplet, nitrogen bubbles, atherosclerotic debris, tumor fragment, bone marrow, or even foreign body. শুধু যে thromboembolism হয় সেরকমই নয়, এগুলোও হতে পারে। These are the types of embolism. Pulmonary embolism, systemic embolism, fat embolism, air embolism, decompression sickness, amniotic fluid embolism, atrial embolism, tumor embolism. Now pulmonary embolism. Pulmonary embolism originates from DVT and is the most common form of thromboembolic disease. Pulmonary emboli are more common in hospitalized or bedridden patients who are prolonged non-ambulatory patients, but it can occur in ambulatory patients as well. Thrombi originating from large veins of long legs. Less common source include thrombi in varicosity of superficial veins of legs and pelvic veins. Fragmented thrombi from DVT are carried through progressively larger veins and right side of heart. কোথায় ফর্ম হলো লেগে ফর্ম হলো, তারপরে কি হবে এম্বোলাস ফর্ম হলো, প্রথমে থ্রম্বাস তারপরে এম্বোলাস হলো। এম্বোলাস হয়ে কি করবে, ভেন দিয়ে যাচ্ছে, কোথায় যাবে, ফার্স্ট হার্টে গেল, হার্টে কোথায় হার্টে with the through superior vena cava or inferior vena cava, heart which chamber of heart? Right atrium. Then from right atrium to right ventricle. After right ventricle, it will go to the pulmonary circulation through pulmonary artery. So it will go ultimately pulmonary circulation. সেখানে গিয়ে ও pulmonary thromboembolism করে দিচ্ছে। So, depending on the size of embolus, it can occlude the main pulmonary artery, straddle the pulmonary artery bifurcation. যেখানে pulmonary artery-টা bifurcate করছে, সেইখানে গিয়েও ব্লক করতে পারে। Most pulmonary emboli are clinically silent because they are small. Sudden death, acute right heart failure, or core pulmonary or cardiovascular collapse occur when emboli obstruct 60% or more. Between the bifurcation of the pulmonary artery are thrombus emboli lodged. Consequence of pulmonary embolism: sudden death, acute core pulmonary infarction, pulmonary hemorrhage. Resolution: pulmonary hypertension, chronic core pulmonary arteriosclerosis. These are the effects: pulmonary thromboembolism, acute core pulmonary infarction, resolution, pulmonary hemorrhage, pulmonary hypertension, sudden death. Now, systemic thromboembolism. Arterial thromboembolism caused within the heart, more common, 80 to 85% cases, caused within the heart. These are mural thrombi in the left atrium or left ventricle. Vegetations on the mitral or aortic valves, caused within the arteries. These include emboli developing in relation to atherosclerotic plaque, aortic aneurysm, pulmonary veins. Venous thromboembolism. Venous emboli may rise from the following source: deep vein thrombosis or DVT of the lower leg, thrombi in the pelvic veins, thrombi in the veins of upper limbs, thrombosis in cavernous sinus of the brain, thrombi in the right side of heart. The most significant effect of venous embolism is obstruction of pulmonary arterial circulation leading to pulmonary embolism. It is the most common effect, pulmonary embolism. Now, fat embolism. Fat embolism refers to the presence of microscopic fat globules associated with hematopoietic bone marrow, the vasculature after fracture of the long bones. A long bones consist of red marrow, yellow marrow. From yellow marrow, these fat globules formation occur. And these fat globules cause the embolism, pulmonary thromboembolism. Soft tissue trauma and burns, it is fairly common, occurring in some 90% of individuals with severe skeletal injury. Diabetes mellitus, fatty liver, pancreatitis, sickle cell anemia, decompression sickness. Now, fat embolism syndrome characterized by pulmonary insufficiency, neurologic symptoms, anemia, thrombocytopenia. It is fatal in 5 to 15% of cases, typically 1 to 3 days after injury. There is sudden onset of tachypnea, dyspnea, tachycardia, irritability, restlessness that progress to delirium or coma. Thrombocytopenia is attributed to platelet adhesion to fat globules and subsequent aggregation or splenic sequestration. Anemia can result from similar red cell aggregation or hemolysis. A diffuse petechial rash is related to rapid onset of thrombocytopenia. Thrombocytopenia হচ্ছে সেই কারণের জন্য পেটেচিয়াল র্যাশ হচ্ছে, স্কিনে র্যাশ হচ্ছে। Now pathogenesis. Mobilization of fluid fat may occur following trauma to the bone or soft tissue. Fat globule released from the injured area may enter into venous circulation. একবার venous circulation enter করলে কি হবে? Same process. ভেন থেকে superior ভেনে পাবো, inferior ভেনে পাবো, তারপর right atrium, then right ventricle, then pulmonary circulation reach করবো এটা। The small blood vessels of lungs are chemically injured by high plasma level of free fatty acid, resulting in increased vascular permeability, consequent pulmonary edema. Consequence: pulmonary fat embolism, hyperemia, edema, petechial hemorrhage, and change of adult respiratory distress syndrome, and systemic fat embolism. Now, gas embolism. Air, nitrogen, and other gases can produce bubble within the circulation and obstruct the blood vessels. Mainly air and nitrogen. এই দুটো গ্যাস ফর্ম করে air embolism. Two forms of gas embolism. First is air embolism. Second is decompression sickness. Air embolism occurs when air is introduced into venous or arterial circulation. Then venous air embolism, air may be sucked into systemic vein at the time of operation of the head, neck, trauma operation, obstetrical operations and trauma during childbirth by normal vaginal delivery, cesarean section, abortion, intravenous infusion of blood and fluid, যখন আমরা IV blood দিচ্ছি বা fluid দিচ্ছি, if amount of air, any amount of air introduced by chance, wrongly, যদি আমরা air introduce করে ফেলি ভেনের মধ্যে, তাহলে air embolism হবে। And during the process of angiography. Now, arterial air embolism. Entry of air into pulmonary vein or its tributaries may occur following conditions like cardiothoracic surgery, trauma, paradoxical air embolism. This may occur due to passage of venous air emboli to the arterial side of circulation through a patent foramen oval. Patent foramen oval কোথায় থাকে? Foramen of oval between the two atrium, right atrium and left atrium. Between the two atrium, pathologic, it is a congenital malformation, normally foramen of a closed hole after birth. But if it is become patent, closed hole now, then paradoxical air embolism will occur. The effect of air embolism, marble skin, air bubble in the retinal vessel, failure of the tongue, coronary or cerebral arterial air embolism may cause sudden death. Now, decompression sickness. Decompression sickness or Pageant's disease. This is a specialized form of gas embolism known by various names such as Pageant's disease. Decompression sickness is produced when the individual decompresses suddenly, either from high atmospheric pressure to normal level. একটা হাই অ্যাটমসফিয়ারিক প্রেশারে অনেকক্ষণ কাজ করার পরে যদি সাডেনলি নর্মাল এয়ার প্রেশারে আসে তখন ডিকম্প্রেশন সিকনেস হয়। In divers, workers in pensions, tunnels who descend to high atmospheric pressure, increased amount of atmospheric gases, mainly nitrogen, oxygen, carbon dioxide, are dissolved in the blood and tissue fluid. যখন ওকে সাডেনলি ডিকম্প্রেস করা হচ্ছে, সাডেনলি যখন নর্মাল প্রেশারে আসছে তখন ওই গ্যাসগুলো বেরিয়ে আসছে, বেরিয়ে এসে ভেঙে যাচ্ছে, ভেঙে এসে আবার সেই একই প্রসিডিউর, একই প্রসেস। Clinical effects of decompression sickness are two types, acute and chronic. Acute form occurs due to acute obstruction of small blood vessels in the vicinity of joints and skeletal muscle that bends as the patient doubles up in bed due to acute pain in joints, ligament, and tendons. Patient cannot standing straight, curl up হয়ে থাকবে patient, bend হয়ে থাকবে। The chokes occur due to accumulation of bubble in the lung, resulting in acute respiratory distress syndrome. Cerebral effect may manifest in the form of vertigo, coma, and sometimes death. Chronic form is due to foci of ischemic necrosis, avascular necrosis of bones, neurological symptoms, lung involvement in the form of hemorrhage, edema, emphysema may be seen, result in dyspnea, non-productive cough, and chest pain. Skin manifestation, itching, patchy erythema, cirrhosis, and edema. This is the most serious, unpredictable, and unpreventable cause of maternal mortality. During labor and immediate postpartum period, the content of amniotic fluid may enter in the uterine vein and reach the right side of heart. Clinical syndrome, sudden respiratory distress, dyspnea, deep cirrhosis, cardiovascular shock, convulsion, coma, and death. Morphologic features, hemorrhage, congestion, edema, dilatation of right side of heart. These changes are associated with identifiable amniotic fluid content within the pulmonary microcirculation. Now, tumor embolism. Malignant tumor cell invade the local blood vessel and may form tumor emboli to be lodged elsewhere, producing metastatic tumor deposit. Notable example, clear cell carcinoma of kidney, carcinoma of lung, malignant melanoma. Now, just take home message. Thrombosis development usually related to one or more components of Virchow triad, endothelial injury, abnormal blood flow, stasis or turbulence, hypercoagulability. Thrombi may propagate, resolve, become organized, or embolize. Thrombosis causes tissue injury by local vascular occlusion or by distal embolization. An embolus, solid, liquid, or gaseous mass. Most are gizlosed thromboembolus. Pulmonary emboli derived primarily from lower extremity, deep vein thrombosis. Their effect depends on the size of the embolus and the location in which it lodges. Consequence: right-sided heart failure, pulmonary hemorrhage, pulmonary infarction, or sudden death. Systemic emboli derived from cardiac, mural, or valvular thrombi, aortic aneurysm, or atherosclerotic plaque.